I'm Dr. Jerome Cordova. I'm the owner and medical director for Viva IV Therapy. So, the purpose of this video is to tell you exactly what Viva IV Therapy is about. What do we do? What is it for? Well, as a critical care physician, I've also worked in the fields of emergency medicine, urgent care, hospital medicine, and a variety of others. And I've been through the system as a patient, and I've also been through the system as a physician. So I know all the ins and outs of how it works, the costs associated with it, and a variety of other things. So, when you're sick, it's not fun. So, currently the way the system works is if, for example, let's say you have a foodborne illness. You're nauseated, you're throwing up, maybe you have some diarrhea, you're fatigued, you're having some fevers, you feel terrible. So, currently the different options that you have available to you are, one, you could go to a primary care doctor. Sometimes primary care providers immediately available, most oftentimes not. Sometimes you'll have to schedule an appointment with them, so they say, hey, we'll schedule you for tomorrow, or this afternoon, or in 2 days from now, a week from now. And sometimes that's just not feasible. You feel terrible now. You want to get treated now. You feel terrible. Come on. So the next option is, hey, you want to be seen faster, so you go to an urgent care. So in urgent cares, sometimes there's a long wait. Sometimes it's a person that you're not familiar with, a physician, a nurse practitioner, or a physician assistant, wherever it happens to be. And sometimes you'll go through a system of signing up a ton of paperwork, going through the hospital system, and it could be time consuming and it could be expensive. So it could cost hundreds to thousands of dollars just to be seen for whatever illness you have in an urgent care. In terms of an emergency department, which is the next option, is even worse. So sometimes the waits are even longer because it's not an emergent thing. Sometimes you might be basically delayed for sicker people, and the cost of an emergency department is significantly more expensive than that of an urgent care or even probably a primary care doctor. So the whole purpose of creating Viva IV Therapy was to fill that gap, saying, hey, one, I want to make it faster to treat patients. I want them to be seen faster, get their symptoms treated, and feel better. So that was the primary goal. Another thing is that I wanted to make it more cost effective. So affordability is a huge thing in medicine. So let's say you have this illness, you're working your 9-to-5 job, and you go to an ER, and oh my God, the bill, it could really hurt you. Paying hundreds of thousands of dollars just to get treated, just to feel better, so you could go back to work. So at Viva IV Therapy, our goal was to make it very affordable in addition to improving the time that it takes to get treated. Another thing is that sometimes a lot of these things, they're very simple to treat. So you have nausea or vomiting, hey, you need some fluids. You need some anti-nausea medication. Maybe you need an anti-pain medication to help with that. So I've created a bunch of different protocols specifically to specific symptoms. So you'll see in our different IV therapy menu that I have things like a migraine IV. So it gets exactly to the specifics. It'll give you some anti-pain medication to help with a headache. It'll give you some caffeine, because oftentimes that could be contributing to a migraine. It gives you some fluids, and sometimes it could give you some anti-nausea medication to help with that migraine effect. We also have one specifically for foodborne illness that helps treat those same type of things. We have a hangover IV. We have different types of multivitamin IV infusions. We have immune boost infusions. We have a Myers cocktail, and we have a variety of other different vitamin infusions that will help you feel better. Okay. Another thing is we don't only do IV infusions, but we also do a variety of other things, including peptides, specifically weight loss. So the GLP-1s are great for weight loss. They help by reducing appetite and also slowly decreasing the GI tract. So basically, you don't have that appetite, you're not eating as much volume, and you have pretty significant weight loss, and the results are pretty great from that. Another thing that we offer is urgent care. So let's say you have a urinary tract infection, or you have a sexually transmitted infection, you have an upper respiratory infection, you have asthma, whatever it happens to be. There's a variety of different specific illnesses that I have listed that you could either do a telemedicine consult, or you could be seen in our clinic to be treated for that immediately. and is significantly more cost effective than being seen in an ER or urgent care, especially if you don't have insurance. So we also do different aesthetic things. Sorry, I had some problems saying that. Aesthetics. So we do things like Botox. We're about to do fillers. We do microneedling. We also do PRP. And each of the different services is listed on our website. So you could go through our different services and you could fully evaluate what specifically is your need. Is it urgent? Is it something that needs immediate attention today? Is it something that you want to book an appointment for aesthetics? We could do those by appointment, or you can do it by walk-in. So at Viva IV Therapy, we're filling the gap, and that's the whole purpose of Viva IV Therapy. So I want you to evaluate our website at vivatherapy.com and take a look through our services. And if you have any questions, feel free to reach out. We have a contact us page. Send us an email. Give us a call. Happy to chat with you. And if you need anything, we're here to help you. Thank you.